Hi, today I will be talking about stock law. It is one of several important healthcare laws that physicians and other healthcare professionals should be aware of. It is also known as Physician Self-Referral Law. It was enacted as Ethics in Patient Referral Act in 1989. It came into effect as Stock Phase 1 law on January 1, 1992, barred physicians from self-referring Medicare and Medicaid patients to laboratory services. In 1995, Stock Phase 2 law was enacted and included various designated health services to which physicians cannot make self-referral of Medicare and Medicaid patients. In 2007, Stock Phase 3 law was enacted and made clarifications regarding in-office ancillary services and physicians in group practices. Stock law is a federal law that prohibits physicians from referring Medicare and Medicaid patients for designated health services to entities in which they or an immediate family member has a financial relationship. There are 11 categories of designated health services that are subject to the stock law's restriction: clinical laboratory services, physical therapy services, occupational therapy services, radiology services such as CT scan, MRI, ultrasound, and nuclear imaging, radiation therapy services, durable medical equipment and supplies, parenteral and enteral nutrition equipment and supplies, prosthetics and orthotics, home health services, outpatient prescription drugs, inpatient and outpatient hospital services. Family members can include a spouse, children, parents, grandparents, and siblings. Physicians can be either MDs, DOs, dentist, oral surgeon, chiropractors, optometrist. Nurse practitioner and physician assistants are not included. Stock law is enforced by Center for Medicare and Medicaid Services, Office of Inspector General in Health and Human Services, and Department of Justice. Stock law is a civil law and violation can result in civil penalties such as denial of payment, refund of the payments, $10,000 fine per service, $100,000 fine per circumvention scheme. Physicians can be barred from participating in Medicare and Medicaid program. Violation of stock law can also lead to False Claim Act violation and anti-kickback statute violation. To ensure that a physician is not violating stock law, they must evaluate any economic benefits they receive from entities to which they refer Medicare and Medicaid patients. Definition of a referral. All of the following qualify as a referral under stock law. Any physician request for an item or service that is payable under Medicare Part B. A referral for a consultation and all the services ordered as a result of the consultation. A prescription for a course of treatment using designated health services. There are several exceptions to the stock law. To qualify for the exceptions, a practice must meet the definition of a group practice as defined by the stock law. Many of the stock exceptions require that when a financial relationship exists, they should reflect a fair market value. Many of the exceptions in the stock law require that any compensation should be calculated without taking into the account of the volume or value of the referrals. Group practice. A group practice must include 2 or more physicians who are legally in a partnership or professional corporation. The group must function as a unified business, should have a central decision-making, consolidated billing, accounting, and financial reporting. This requires a single taxpayer identification number. Physicians in the group practice share overall profits and can be paid a productive bonus for the services that they have provided. Each physician in the group must provide his or her full range of services in the group practice through a shared office space or facility. The group's overhead expenses and income must be established before the payment is received for the services provided. Amount of time physicians spend at work dedicated to the group practice must average 75%. Fair market value. It pertains to any compensation resulting from an arrangement between a physician and an entity. Must be in writing and cover specific items or services provided. Specify a time frame. Meet safe harbor regulations under the anti-kickback statute. Exceptions to the stock law include referral for in-office ancillary services and referral to physicians within the group, non-monetary compensation, preventive services, hospital incidental benefits, hospital compliance training, bona fide employment agreement, personal services arrangement, lease arrangement, rural physicians. Exceptions under the stock law: referrals for in-office ancillary services and referrals for physician services within the group. In-office ancillary services must be furnished by the referring physician or by another physician in the same group practice. In-office ancillary services must be provided in a building in which the referring physician or another member of the group practice provides services, or in another centralized location used by the practice. Referrals from one physician to another physician within the group practice is allowed. Non-monetary compensation. Stock law allows non-monetary compensation from a referred to entity as long as it is not in the form of cash or cash equivalent. For the fiscal year 2025, the annual limit is $519. The compensation must not violate anti-kickback statute. Physician or the group practice should not solicit it. Example, holiday gifts given by the referred to entities to the referring physician. Preventive services, immunizations, vaccination and screening tests are exempted from stock regulation as long as they meet the frequency limits set by CMS and they do not violate the anti-kickback statute. Hospital incidental benefits. Stock regulation permits hospitals to provide their medical staff members with incidental benefits in the form of items or services should be used within the hospital campus. The compensation should be offered to all members of the medical staff, should be consistent with the benefits offered to the medical staff members at other hospitals in the region. Each occurrence of benefit should not exceed $45. Example, cafeteria meals, free parking, free internet. Hospital compliance training. Stock regulation allows hospitals to provide compliance training to physicians who practice within the community. It involves training in basic elements in compliance. Bona fide employment agreement. Many physicians are engaged in administrative relationship with the entities to which they refer patients. For example, being a medical director or a department chair. This exception allows payments of any amount by the entity to the physician for providing services in the case of such agreement. Payment should be consistent with fair market value and agreement should be in a contract form. Personal services arrangement. This exception allows a physician to be engaged in a contract that makes him or her an independent contractor with the referred entity. It must be in writing and signed by both parties, and the contract must be for 1 year. Compensation should not take into account the volume of referrals by the physician. Lease arrangement. When a hospital leases office space or equipment with physicians who refer patients for designated health services, both parties must sign a written lease agreement. The space rented or leased must not exceed what is reasonable for the purpose of the lease. The space that was leased should be used exclusively for the purpose of the lease. Rental charges must be consistent with fair market value. Rural physicians. The stock law allows a physician to refer a patient for designated health services to an entity that the physician or a family member has invested as long as the entity qualifies as a rural provider and 75% of its patients come from rural areas.